brand new way to get rid of ugly scars.
We are going to do the scar treatment trifecta today.
All new today on The Doctors.
What if I told you there was a new way you can erase embarrassing scars? Well, it's true, and we have it. JC's backstage with Dr. Orden and dermatologist Dr. Sandra Lee. They're going to show us how it works.
That's right, Travis. Welcome, Dr. Lee. Always a pleasure. My favorite
you.
dermatologist. And JC. And we're talking about something very important today. Scars, specifically hypertrophic scars.
Yes.
And JC has a hypertrophic scar that we're going to treat in 1 second. But first of all, scarring, perfectly normal. It's the body's response to injury. We go through 3 healing phases. Maturation is the last one. When we form scars, we're doing 2 things. We're breaking down collagen, and we're making new collagen. And you have a special treatment for us today.
We are going to do the scar treatment trifecta today. We're going to use a lot of
modern horse races.
Modern techniques here. So first what we're going to do is we're going to actually inject it with an intralesional steroid. And as you know, this has been around for decades.
Right.
But we're going to make it a little more modern by actually adding a chemotherapy agent. 5-fluorouracil. We have found that when we add that, that can also decrease the size of the scar, but actually minimize side effects too. So right now, I'm going to inject one of him.
5-FU for skin cancers,
yes,
for pre-malignant lesions. So
and also used to treat breast cancer as a chemotherapy agent infused. So we have multiple uses for it. So I'm going to inject one area. She's actually a little numb here too. Sometimes it pinches a little bit, but we use a baby needle, and we're just going to inject one of them. And we kind of do this every few weeks, maybe, or even every couple of weeks, if you could hold that right there. To help to minimize the scar. Next, what we do is we can use a topical medication that they can take home. This is called imicamod, and this is an immunomodulator. This is really a new class of medications, which is really cool because we're discovering multiple uses for them. This one specifically, what they do is they actually rev up your immune system. They get you excited, and they make your immune system realize that there's something going on there, and hopefully this will help to minimize the scar. And lastly, you can't talk about the future without talking about lasers, right? So here we have one of my favorite lasers. This is called the Mix-2 Microfractional CO2 laser. I want to demonstrate on this artichoke, for example. This is not an artichoke, sorry. This is an eggplant.
Boy, she gets excited about this laser. I love it.
I do. And, you know, this is where you have it fractionated. You can see it treats only a portion of the skin, so it's safer, there's fewer side effects, and we can treat people under local anesthesia. But in this case, we're going to use it in the fully ablative setting, and we're going to try to sand down, try to even down this scar. And we're going to do part of it right now, if you guys are ready.
I'm
okay?
ready.
We're going to treat
Is
this portion
Tracy ready?
right. Yeah, she's ready. We numbed her here, so she should.
So this is CO2
Right
laser in the ablative mode, right?
Yep. So we're just going to ablate, and we're going to do this a few times, most likely.
How many times, most likely, will you have to repeat the laser?
Until you feel like you've got the effect that you want. You know, this is something that is a work in progress. It doesn't, you know, it doesn't improve overnight.
And we have some pictures to show of before and afters going through your trifecta regimen, combining this, and
so you can see, over time. I mean, multiple treatments will show. You'll have a nice result, and that's what you want. You want a flattened scar. That is a hypertrophic scar on the left and a flattened, improved scar on the right. So.
And Dr. Lee, really quickly, normally when we have lasers on the show, we wear glasses. Is this slightly different in that regard?
This one is different in the sense that we're okay as long as I'm directing in the area, and I'm only doing a couple little steps.
Right, it's related to how much light you're getting. These were quick little bursts. Okay.
Thank you so very much.
Thank you.
Thank you.